yeas are 220, the nays are 215. The bill is passed.
President Obama signed the Patient Protection and Affordable Care Act in 2010, which offered protections to individuals living with chronic illnesses such as HIV, which had previously made it difficult or impossible to find healthcare coverage. The same year, the National Institute of Health released results of a study which found that when HIV-negative MSM take a daily dose of HIV medication, their risk of contracting HIV decreased up to 99%. Further research showed PrEP to be effective through heterosexual sex as well. In 2012, the FDA approved Truvada for PrEP.
One of the newest tools is a preventative medicine called PrEP.
Only 10% of the over 1 million individuals that are really vulnerable to HIV were actually accessing PrEP.
As research continued, scientists discovered U equals U, or undetectable equals untransmissible. Because of this, the World Health Organization recommended that all HIV-positive individuals start antiretroviral therapy as soon as possible after receiving a positive test result.
Well, doctors say with new treatments and medication, HIV is no longer a death sentence. That's especially true for Marcelia Bruman, who has lived with the disease for almost 20 years.
HIV doesn't have me. I have HIV.
While I was at DIS staff in 2012, it was also the same year that the federal government okayed PrEP, which is a post-exposure prophylaxis for individuals who were living with HIV/AIDS. It was also a preventative for individuals that had high risk activity in the community. And along with the education that we were providing to the folks in the community, or those that were receiving counseling, was that they could use PrEP as an option.
Free from the risk of HIV. From the makers of Truvada, a new PrEP option. Descovy for PrEP, a once-daily prescription medicine that helps lower the chances of getting HIV through sex.
In recent years, we have made remarkable progress in the fight against HIV and AIDS. Scientific breakthroughs have brought a once distant dream within reach. My budget will ask Democrats and Republicans to make the needed commitment to eliminate.
In 2019, President Donald Trump announced a plan to end the HIV epidemic in 10 years. This plan seeks to reduce the number of new HIV infections by 75% in 2025 and 90% in 2030 by utilizing new data, prevention, and treatment options.
Last year, the FDA approved Cabenuva, the first long-acting injectable treatment for HIV, which is taken once per month rather than a daily oral regimen. Later, the FDA also approved a bi-monthly injection of Apretude for PrEP.
This medication is a definite game changer.
U of L Health's Dr. Mark Burns says the drug can improve effectiveness because people can easily forget to take daily pills, which is one popular HIV prevention method.
On World AIDS Day last year, President Joe Biden released his National HIV/AIDS Strategy, which outlines goals and objectives to end the HIV epidemic by 2030.
So the number one way that we can combat disparities in HIV prevention is to really engage with the community, which is what our PrEP team does. They're going out there, they're finding individuals who are most at risk and trying to identify populations that may not consider themselves to be high risk.
Hi, I'm Mary and this is Alex, and we're the PrEP navigation team at 3rd Street Family Health Services. As PrEP navigators, we work within the community to help prevent the spread of HIV, as well as provide education about other STIs and safer sex practices. This Thursday, December 1st, will mark the 34th year that people around the globe have observed World AIDS Day.
So as a community health center, 3rd Street is a pillar in our community. We have been very intentional in ensuring that there's a 3rd Street presence in 3 of the major counties in this mid-Ohio area. We have access in Crawford County, Ashland, and Richland counties to support individuals who are living with HIV. Preventive care is also a part of our mantra. As primary care providers in this community, we try to ensure that the community has an outcome that can be expected, that even though you may have walked down a path of unhealthy lifestyle, our practitioners try to reverse that narrative and help you get to a place of longevity and manageable care.
While researchers continue to seek a cure for HIV and have been able to essentially cure 2 separate individuals via bone marrow transplants, they warn that this type of treatment will not be a viable option to cure HIV for all individuals, as it is extensive, dangerous, and costly.
The big question now is, can it be replicated in the future? Can it cure more people?
And that's what scientists are still looking into. They're looking into other patients who may have been cured with bone marrow that has the same mutation. Now, while a transplant is not a practical treatment for the masses, researchers are investigating gene therapy approaches. Meanwhile, there have been major advancements in recent years for drugs that suppress HIV.
Additionally, they have attempted this treatment many times, and the results are inconsistent and have failed to produce desired results more often than not. However, researchers have been inspired by the successes they have had in these cases and are confident that a cure can be found.
I think a few things that we're doing here at 3rd Street is educating our providers more on things like PrEP, what that means, what that looks like, making sure that our providers feel comfortable and competent to provide that care. Because that's a key, right? If you don't feel comfortable or competent in that, then you're not going to want to take on patients who have whatever that disease state or that illness is. And so first of all, we're starting to do training. We're also trying to focus on those providers who really do want to treat HIV because they have an interest in it and an interest in even prescribing PrEP. And that's a key piece moving forward. Having somebody who has that interest, that has the expertise, that has the competency, and will welcome those patients in our doors always.
Being supportive of individuals who are living with HIV is a very important contribution to our communities. Similar to anyone who's living with some type of disease or state that needs that support. There may be family members that we have that are unwilling to share their story because of fear. And having an open ear and understand, or a desire to understand or provide feedback and provide that support, I think will begin to change the narrative in our communities about living with HIV or AIDS.
It's been you who fueled my dogged faith in our future, even when the odds were great, even when the road is long. Hope in the face of difficulty, hope in the face of uncertainty. The audacity of hope.
I've been in the epidemiology field for about the last 15 years. And while working in the city of Detroit, World AIDS Day was an opportunity for us to promote more awareness and understanding of not just the disease, but the prevention that can happen with certain activities.
You know, World AIDS Day means a lot to me, and I think to a lot of different people, in regards to, for some, it's a remembrance of those that we've lost, honoring those that maybe fought the fight before us. I also like to think of it as a celebration of how far we've come, of the future. Who knew that we would have, you know, in the 80s and then even in the early 90s, who knew that we would have a treatment now?
Working with individuals who have newly been diagnosed with HIV, there's a stereotype that, especially in the city of Detroit and other areas where HIV is prevalent, is not always in the rundown communities. It's not always in a place that is unsafe to go. These are people who are living everyday lives and may have had an event that changed their lives. One of the things that 3rd Street is championing with having a PrEP program is to have more PrEP and POPI providers available to prescribe PrEP and manage a person who's living with HIV.
It seems like humanity's natural instinct is to, because you can't see a virus, it's to target the people who are falling ill first. And it's always those people, those first people who get sick, who need the most help but are the least likely to get it because of the stigma that surrounds it and the fear that surrounds it.
The stigma certainly has changed over the years. So there, back in the day, there was also the thought that you would probably die within 10, 15 years. And that's just not where we are today. The treatments are so much better. But the stigma has changed, I think, for a couple of reasons, and it's still there. But we have more acceptance of the LGBTQ community. And when we have that acceptance, then we're not blaming them always for an illness that doesn't just live in the LGBTQ community, but has been stereotyped to be there, and certainly more at-risk folks, absolutely. But when we accept that who somebody loves and is attracted to isn't part of morality or isn't part of that, it's who they are. When we can accept that, then the medical illness can just be the medical illness. And I think that's where stigma has changed the most, is that it is medical and it's not a social construct around morality.